This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good evening, ladies and gentlemen, and welcome to Philippines Uncut. I'm your host, Buddy Kunana, and on this show we talk about everything under the sun. And tonight we're talking about, once more, about one of my favorite advocacies, and that is health and wellness. In particular, we're going to talk about a new technology in medicine that claims to be effective in treating cancer, cardiovascular diseases, diabetes, and a host of other illnesses and conditions. I'm talking about none other than intravenous laser therapy. And joining us in the studio tonight are two of the doctors who are at the forefront of this new technology in the Philippines. We have with us Dr. Madge Gialone, and she is a family medicine, occupational health, and practicing dermatologist. Good evening, Dr. Madge.
Good evening.
Welcome to Philippines Uncut.
Thank
Thank
you.
you. And joining her, of course, is Dr. Danilo Delfin. He's a cardiologist and also at the forefront of in intravenous laser therapy. So, Dr. Delfin, welcome to Philippines Uncut. It's a pleasure to have you and Dr. Madge here.
Thank you for inviting us here.
Yes, and that video we saw, it's actually it's an advertisement of a health, an alternative health clinic in the States. And the reason I play that is because, as I mentioned, here in Philippines Uncut, we really espouse alternative treatments, alternative medicines. In effect, looking for other ways to address the age-old problem of health and wellness and illness. And this is where your technology, the technology that you guys are pushing in the Philippines, this is where this lies, in the realm of alternative medicine and alternative treatment. Now, let's talk about your background first. Let's start with Dr. Madge. Dr. Madge, tell us a bit about yourself. Your background as a doctor, as a physician, etc.
Okay. I'm a certified family physician and also into occupational health. And I'm a practicing derma in a skincare company, but I'm not a dermatologist.
Oh, okay. What is the difference between, please, I apologize for the mistake, but please explain to us, what is the difference?
Well, actually, if you're a family medicine, if you undergo the training,
Yeah.
you will go in every department.
Okay.
So I have already an idea and on treating skin problems, but I'm not a certified dermatologist. No.
But
Just a practicing.
Yes. If you're a family medicine doctor, does it mean is it the same as saying you're a GP or general practitioner?
Yes.
Okay, so it's another term for GP.
Well, actually, family medicine is you went into a training for 3 years.
All right.
Yeah, in a hospital.
Okay.
So and then after that you make some sort of study, and then they will give you a certification by the Philippine Academy of Family Physician.
Okay, all right. And then, okay, let's talk about occupational health. What does that mean exactly?
Occupational health is if you're going to if you're going to work in a company,
Okay.
you should have a seminar or a workshop on about occupational medicine.
All right.
So that will take around a month. Yeah, a month. So
Okay.
it's more of a seminar,
Yes, yes. But
a workshop.
what does it mean actually? I mean, what when you say occupational health, occupational medicine, what are you addressing? What do you talk about here?
We address more on the diseases, the problems that you will encounter in a company, in a corporation.
Example.
Like for example, occupational hazards, you know, the injuries inside the company, their exposure to noxious substance, something like that.
Okay.
You be the one to take care of the employees inside the company.
Yeah, but that's also very broad, no? Because
Yeah, it's very
I
broad.
mean, you know, for different employees in different companies, there are different. The working environments are very different.
Right.
So how do you study for all these different types of working environments, for instance?
Well, I'm connected in a company that into trading.
Okay.
So you don't expect more of a hazardous exposure with the employees.
Okay. So what are the usual health issues in a trading company?
Oh, you expect, of course, trading like musculoskeletal diseases.
Okay.
Uh-huh.
All right. All right. Very nice. Very nice. Okay. Thank you very much, doctor. And let's talk about. Let's go move on to Dr. Delphine. Dr. Delphine, what is your background in cardiology?
I finished my adult cardiology training at the Philippine Arts Center. Then I pursued my subspecialty training in non-invasive cardiology at the same center. Then I was invited here in this IV laser therapy as a non-pharmacologic modality in the management of heart diseases, and I feel that it is a good opportunity for me to expand my horizon in terms of management.
How long have you been a cardiologist, Dr. Delphine?
I had my 1992.
Okay. So, I mean, we're talking about over 2 decades
Yes.
as a practicing cardiologist.
Yes.
Kaya, Dr. Madge, how long have you been a family medicine, occupational health practitioner?
Since 1993.
So same, more or less, the two of you have been in Western medical practice
Yes.
for over 2 decades, more or less.
Yeah.
Okay. So, okay, I want to throw this question out now because we're talking about alternative therapies and non-conventional treatments. Conventional meaning what you matriculated in, basically, which is Western medical science. No, what led you to go down this route? After being 20 years as a cardiologist, 20 years as a family medicine, occupational health practitioner, what led you down to this alternative route? Let's start first with Dr. Madge.
Okay. I met the brother of the owner of the skincare clinic. So he mentioned to me about there's a new Russian technology now that's in the Philippines, and it's being used in Cebu. So I started asking many questions, and I got interested. So we went to Cebu and visited the clinic. Surprisingly to see that there are a lot of patients, and I did some interview, and the result was positive.
Yes.
I mean, they responded to the medicine and to the treatment, and
You
so
saw this for yourself?
yes,
Okay.
yeah.
Okay.
And then not only that, but I've observed that many of the patients, the features is they look younger than their age.
Yes, yeah.
So I did ask that question again to them, and they say during the time that they have this treatment, they noticed that they were energized
Okay.
and they look younger.
Okay.
So that leads me to join the laser clinic.
Now, Dr. Delphine, how about you? You were a cardiologist over 20 years. What led you down this route, the alternative medicine route? I mean, the reason I'm asking is because the two worlds are actually sometimes, or not so rare. It's not so rare that they are sometimes at odds with each other. No. So what brought you to this field?
During my training, whenever had any information regarding laser therapy,
Yes.
but I heard from other doctors from other specialties like ophthalmology, dermatology, surgery, that they're using laser modality.
Yes. Yes.
Not only that, even in dentistry. So when I was invited here, I made a research then focus myself on heart diseases. So I found it interesting, and for me, I think it's an opportunity that I can make all my patients maximize their own well-being.
Now, like Dr. Madge, did you see, when you first were introduced to this, did you see that there was a good potential, that there were patients who were actually recovering or responding positively to the treatments?
Actually, I was with Dr. Ahmad's in
Yes.
Cebu.
Yes.
We went to Cebu, and we observed the different experiences of the different patients, especially the very rewarding experience
Yes.
observed by all the patients, like for example in diabetes, in chronic renal disease, in hypertension. So I think it's very rewarding, and we can give other options for our Filipino patients to
Yes.
maximize their
Yes.
management in
And
health
their
is-
options, no?
Yeah.
Give them options because, let's face it, doctors, when you go to a hospital or a clinic and it's a Western, conventional
Yeah.
medical facility, I mean, automatically it's going to be either take something and we'll prescribe you medicine or have a procedure.
Yes.
Procedure, I mean some sort of operation depending on what you need. But with this one, this is minimally invasive, a minimally invasive technology with, as I understand, very little side effects or no side effects at all.
No side effects.
Now, let's talk about the doctor. Let's talk about what is intravenous laser therapy all about.
Intravenous laser therapy is using a light intensity radiation, particularly on the blood, to improve the microcirculation. Not only microcirculation, but also the different components of the blood,
Okay.
like white blood cell, red blood cell,
Okay.
etc.
By exposing them to laser radiation.
Yes,
Now,
yes.
that's also another big word. When you say radiation, a lot of people are scared of that. I mean, people are scared of the word radiation. What is? I mean, should people be concerned about this technology then?
Well, based on initial studies and recent articles on laser therapy, it has no side effect. They are using just a therapeutic dose of radiation that can help or improve the health of the patients.
Yes, yes. No, so what kind of technology is this? Where did it originate from? Has it been here a long time already? This intravenous laser therapy? Intravenous meaning through the blood. No, I mean, that's
Through the
what-
blood, yes.
That's what we mean. All right.
Well, I think in some articles, they have published articles since 1923,
Okay.
but officially it was in 1957 that the word laser was coined by Gordon Gould. So, meaning laser is light amplification by the emitted
Yeah.
radiation.
Yes.
So they are using this to improve microcirculation.
Okay.
So in the blood.
But doctor, how does it exactly improve circulation of the blood? So what happens is we have the machine in front of us, and later we're going to show the video of how it's actually inserted, how the IV, the laser IV is inserted into the vein. How does this now improve blood circulation? What happens exactly in the process?
The theory or the mechanism of action is by means of photobiologic action
All right.
involving all the intracellular components,
Okay.
thus improving or giving them some energetic changes inside the cell. So it's not only on the cellular level, but also on some tissues or organs. But basically, it's more on intracellular action
Yeah.
inside the cell.
Yes. Yes.
So it improves the membrane, and then on the microcirculation, it improves the endothelial function. We call that endothelium.
Yeah. But okay, so this is the machine that you folks use for your laser treatment, no? What happens here? So you have this machine and it's hooked up to a laser, and then, I mean, how is this now applied to the patient?
Okay. We are using this is specialized, sterilized fiber optic needle.
Yeah, let's hold it up for the audience.
Yeah.
to see,
So this is inserted in the popliteal vein.
Okay, in the vein here in the
Yes.
in the arm.
Yes.
Okay.
So this is the distal portion. The proximal portion is inserted to the trunk
Okay.
of this is the one emitting the radiation,
The laser.
the light intensity radiation,
Okay.
the laser.
Okay.
Yes. So this machine has some number of minutes that we
Yeah.
are going to the procedure or the protocol.
Yeah.
We have different protocols for every diseases,
Yeah.
and we have the power or the output that is being used for the radiation,
Yeah.
and then this is the button that will
To
start
begin the
or-
session.
yes, to begin the session.
Okay. So how long is a usual session, and how many sessions does it take for someone to undergo treatment for?
We have different protocols for different health problems.
Okay.
So usually for wellness or protective procedure, it takes about 30 minutes for every
Okay.
session.
How many sessions?
Minimum session of 5.
Okay. Okay. This is
But-
just for wellness.
Yes, or in some minor health problems. But those with chronic diseases like diabetes or problems in the bones, it takes more session to complete the therapy.
Okay. So what you're saying is that this machine is able to treat a host of or supposedly is able to treat a host of conditions. Now you mentioned a lot of things: heart disease, diabetes. What else are the other illnesses that this can treat, for instance?
This all is started in some degenerative problems like in arthritis, osteoarthritis, just to alleviate the pain. But right now, there are some studies using this machine in cancer patients.
Mhm.
There are some reported articles, stage 1 and stage 2
Cancer.
cancer
Okay.
that is now being used. And lately, I read some articles on stage 3 and 4
Okay. Being treated with this,
machine.
and has it been effective in the study so far that you've come across, the research?
Yes,
done?
in
It
fact,
has been.
in 1967, they reported the first article on cancer,
Okay.
comparing those patients' population with this machine, and they found out that there was better survival and better quality of life after using this machine.
This machine. Okay. Now let's talk about your field, cardiology. How is this able to improve circulation and to? I mean, is this machine able to, perhaps help the blood flow in the body better, or is it effective? Can it be used to perhaps declog arteries? What is your company stand or your clinic stand on this?
The initial study or scientific studies using this machine, they're using some parameters,
Okay.
diagnostic parameters, to see the flow
Okay.
of the red blood cell,
Okay.
different blood components, and they found out that it has improved rheology or microcirculation, so that there will be an improved supply of oxygen to the tissues affected by some health problems,
Okay.
like for example ischemia for the heart.
Yes. Yes.
So, and lately they're using now this kind of machine, what we call neovascularization, formation of new blood vessels in the heart.
With this machine.
Yes.
So okay.
There are some scientific studies being now done in some
Yes.
European countries.
Yes, yes. Okay. Actually, we're going to talk about, you mentioned European countries, so we're going to talk about more of the origin of this machine, where it's being used, and how widespread is it. Now, quickly though, how come we haven't seen this machine? I mean, okay, you mentioned in the 50s, this laser was coined as a term, and then you mentioned some studies being conducted in the 70s. How come this technology is only now making its appearance here in the Philippines?
Based on my readings, mostly from European countries like Russia,
All right.
Ukraine, Germany. I think there are some political and economic problems for its country. So in Russia, in 1967 or 70s, they tried to manufacture this kind of machine. So they have different
So it really
clinics.
is a Russian technology.
Yes.
Okay.
And
Doc, hold that thought. We have a pause for a break, but more. We'll continue along that line of discussion when Philippines Uncut returns. Stay tuned.
This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good evening, ladies and gentlemen, and welcome to Philippines Uncut. I'm your host, Buddy Kunana. Now, on this show, we talk about everything under the sun, and tonight we're talking about, once more, about one of my favorite advocacies, and that is health and wellness. In particular, we're going to talk about a new technology in medicine that claims to be effective in treating cancer, cardiovascular diseases, diabetes, and a host of other illnesses and conditions. I'm talking about none other than intravenous laser therapy. And joining us in the studio tonight are two of the doctors who are at the forefront of this new technology in the Philippines. We have with us Dr. Madge Gialone, and she is a family medicine, occupational health, and practicing dermatologist. Good evening, Dr. Madge.
Good evening.
Welcome to Philippines Uncut.
Thank you.
Thank you. And joining her, of course, is Dr. Danilo Delfin. He's a cardiologist and also at the forefront of in intravenous laser therapy. So, Dr. Delfin, welcome to Philippines Uncut. It's a pleasure to have you and Dr. Madge here.
Thank you for inviting us here.
Yes, and that video we saw, it's actually it's an advertisement of a health, an alternative health clinic in the States. And the reason I play that is because, as I mentioned, here in Philippines Uncut, we really espouse alternative treatments, alternative medicines. In effect, looking for other ways to address